Hi, and welcome to the first OTAC webinar of 2024. My name is Jessica, and I'm part of the OTAC team here, along with Dan, who's also joined us today. We typically run clinical case webinars, but today's a little different, and we'll be joined by the SafeScript New South Wales program team, who will give us updates regarding the approval management system in SafeScript New South Wales, including a demonstration. This is of particular relevance for those who are prescribing opioid agonist treatment, as it allows applications to prescribe this medication to be done online rather than paper-based forms. Before we go to the housekeeping portion, I'd like to acknowledge the traditional custodians of the land on which we are on today or dialing in from today, and pay our respects to elders past and present. We also recently launched the OTAC scholarships, which are open to unaccredited general practitioners and nurse practitioners. If you're interested, you can find more information on the OTAC website under the scholarships tab, and just be aware that the next round of applications closes on the 29th of February, which is next Thursday. I very much encourage you to pass this scholarship opportunity on to any colleagues who may be suitable and interested. So these are the registrations for tonight. We have about 43% who registered from regional areas, and over half are from metropolitan areas. We have a lot of people from Illawarra Shoalhaven and also the Southeast Sydney Local Health District. And these are the roles of the people who've registered for today. We have 80 people registered and a lot of general practitioners and pharmacists, but people from every role, which is great. And as a reminder, these are monthly clinical case-based webinars. We will also email a certificate for CPD, and the webinars are recorded and will be made available on the OTAC website, probably tomorrow. And just a little bit of housekeeping, please keep yourselves on mute. There will be time for questions at the end of the SafeScript presentation, so you can either type them in the chat or raise your hand and ask them after the presentation. Again, the webinars are recorded, so if you do ask any questions, don't reveal identifying information. And please be polite and please participate. So I'll pass it over to Karen and the SafeScript New South Wales team.
Thank you, Jessica. I'm just going to share my slides. Hopefully you can all see that. Cool. Thanks for having us today. My name is Karen Inati. I'm the Change and Adoption Manager for SafeScript New South Wales, the real-time prescription monitoring program. Today I'm joined by a few other team members, as Jessica mentioned, and also Wes Scaff, who's representing Pharmaceutical Services Unit, formerly the PRU, and Fraser John, who's a business analyst on the program as well. We'll all be presenting, and we have a few other team members on the call as well to support with any questions for the session. So just a quick overview of what we're looking at today. I'm going to do a quick overview of SafeScript New South Wales. There are a couple of polls we'd like you to complete throughout the presentation. We'll then go into a bit more detail about the new approval management functionality that we introduced last year in SafeScript. Then we will actually have a demonstration of that functionality so you can see it live, how it actually works. We'll then talk through a little bit about the support that's available for practitioners for SafeScript. And then obviously at the end, opportunity for feedback, questions, and anything you might want to raise with the team today. Okay, so I might just jump into it. This is a quick reminder. Hopefully you are all aware of SafeScript New South Wales. In case you're not, it is a real-time prescription monitoring system that gives both prescribers and pharmacists access to patients' prescription history for high-risk medicines. Prescribers and pharmacists receive real-time notifications in their clinical software, which alerts them to any sort of high-risk situations that are detected. And a patient's history can also be accessible through the SafeScript New South Wales portal. The system does not instruct practitioners on what to do. It just provides information and context to support decisions that they might be making in regards to their patient's care. That's a quick overview. So how are we going since we launched? Quick look at numbers here. SafeScript New South Wales was launched in May 2022. Since then, we've had quite a lot of registrations. As you can see, as of today, we are up to about just over 28,000 registrations. And if you look at the table, that is kind of just almost 51% of practitioners that are registered with APRA are actually registered for SafeScript New South Wales. And there's a bit of a breakdown, as you can see here, in terms of medical practitioners, pharmacists, and then nurse practitioners as well. On the right-hand side, this pie chart, I guess, just shows how we're tracking with this approval management functionality that we have introduced. As you can see, on the top sort of red box just outlines how many applications are now coming through using the online application form for OTP. So currently it's already over 40%. So 43% of applications are actually coming through the portal, which means it's just the full online process. We do see still a few coming through paper-based application process for various reasons. But from those that are actually coming through online, we are seeing 70% of them are actually being approved immediately. So literally getting that approval straight away within the same sort of session. So that's a really great number, and we're hoping to see that increase. And today we'll talk you through what does that look like in terms of what will allow an immediate approval and what doesn't, and talk through a bit of explaining that today. So now we have a bit of a poll we'd like you to answer, please. Great, we'll just give you a few minutes to answer that. So the first one is, do you currently use SafeScript New South Wales? And obviously, hopefully some of you do, but it'd be good to know. And then the second question is, have you applied for any OTP approvals online using the SafeScript New South Wales portal? Great. Anyone else want to vote while it's up?
I've ended the poll. Are you able to see the results, Karen?
Yes. Great. So it looks like quite a lot of you, which is great. Actually have you currently using the SafeScript New South Wales, which is fantastic. And we have about less that have actually used the online approvals or application process, which is completely fine. So hopefully after today's presentation, we'll see those numbers increase. Great. Okay, I will continue, and I'm going to hand over to Wes, who's going to talk through a little bit more about the approval management functionality.
Great. Thank you, Karen. So it's really promising to see those poll results. So that's really, really good to see. But just to give you a bit of a background for those of you that are not aware, SafeScript New South Wales has some really cool and nifty features, but effectively it consists of two core functionalities. The first of which, by the looks of things, you're probably mostly aware of, is a real-time prescription monitoring that applies to certain high-risk medicines, which you're able to see dispensed and prescribed information come up for patients. But the second one, which from what I'm seeing from the polls, you might not be as aware of, is the approval management functionality of SafeScript New South Wales. And this is where this new functionality, which was introduced, if I remember correctly, in 13th of November last year, gives you the opportunity to apply to seek approval to prescribe these high-risk Schedule 8 medicines. But effectively, I've got a nice breakdown of what more generally is available through the approval management part of the SafeScript New South Wales system. So effectively, we've gone live with two workflows, if you like. They include the Opioid Treatment Program, or OTP, as well as the Schedule 8 psychostimulant application workflow. But what we are allowing for is for paper-based application forms to still come through whilst we start to continually encourage the use of SafeScript New South Wales, at least the approval management functionality, in addition to what you already are aware of, the real-time prescription monitoring part of it. In addition to that, we are currently working towards adding another couple of workflows, and we're hoping to introduce those in the next few months, possibly late March. And they include things like Schedule 8 pain management workflow. So they include like your oxycodones and your buprenorphine and methadone for pain. your Schedule 8 benzodiazepines, such as alprazolam and flunitrazepam. And finally, and most of you might not be aware, but for those psychiatrists that are with us, esketamine and ketamine for treatment-resistant depression. But yes, again, the existing paper PDF forms will continue to be available. And one of the things that I need to point out, especially as you start to familiarize yourself with the approval management functionality of the system, is we're starting to use this new term, the terminology which has been updated to approvals from authorities. And really, the idea with that was to distinguish the authorities from the Commonwealth PBS authority system, because what we've identified is some confusion in relation to where we sit as part of New South Wales Health and the Poison Therapeutic Goods Act that we administer versus what's done through the PBS, which is more to subsidise the cost of the drug. And that's all reflected in SafeScript New South Wales. Karen, can you please go to the next slide? Yep, so this next slide shows you the PDF form for the New South Wales Opioid Treatment Program. As you can see, it's a really full-on application form, if I could call it that. But what you'd like pretty much captures most of the things. We did refine the forms, as most of you would probably know. But effectively, the nice thing about the PDF form, it's succinct. But what we try to do with the online form is make it a lot smarter. And hopefully when Fraser goes through his case study, you'll be able to see how this PDF form, which is a little bit more comprehensive than what you'd hope to see, especially where some of the questions on the application form don't apply, are removed from the online form. So hopefully that's our little sales pitch to encourage the use of SafeScript. Effectively, approval management in SafeScript New South Wales has a lot of good features. The first of which is obviously the significant enhancement to allow the approvals through the SafeScript system, and that's through the online portal for health practitioners, which you should be able to register for. The whole idea is to help support the process around approvals to make it an efficient and centralized process so that all forms of Schedule 8 medicine approvals are easily managed in one central location. And the nice thing about the system itself is it enables prescribers to submit applications online, monitor the progress of their applications, but also receive approvals in real time in certain cases. And we'll go through a little bit of the certain cases section that details when certain application forms will be instantly approved. But overall, the whole idea was to increase the efficiency of the approval process system. The next slide deals with the differences in terms of access to various users. I might just focus on the first two, but if you have any questions, I guess we could get those questions towards the end. But the first one's medical and nurse practitioners. So they're the bulk of the users of the approval management functionality of SafeScript when it comes to applying, obviously. So with the medical nurse practitioners, they can both apply via SafeScript New South Wales now for the New South Wales Opioid Treatment Program. In addition to that, the overview allows them to apply online, in certain instances, receive immediate approval, which is quite nifty, allows them to review their application progress, and also be notified about the outcome via the email notification process. In addition to that, they receive a wide range of access to certain information, including patient information and approval history, which is available in the grid, and Fraser would show you that in his demonstration, but also see all active approvals they hold for patients that they've applied for under the New South Wales Opioid Treatment Program. In addition to that, it has additional functions like enabling them to exit, cancel, withdraw, and reapply for approvals, update patient personal organisation information, update OTP dosing points, and invite New South Wales Health employees. And just quickly with the pharmacist section, the pharmacists obviously aren't able to apply because there's no need for them to apply, but they are able to search for patient's profile and see active OTP approvals, as well as look at OTP approval history and have the additional functionality of updating patient dosing details. Next slide, please. All right, so this is the slide that I was referring to in terms of where immediate approvals may be the result of their application process. So I'm just going to go through it quickly, but effectively, if a patient has no current OTP approval or one held by the same prescriber, those applicants will receive immediate approval. If prescriber is an OTP accredited prescriber or below the OTP patient limit and has no restrictions, they'll get immediate approval. Prescriber clinic and regulatory patient profiles already exist in the system, immediate approval. If the transfer protocol is used and the approval is linked to a public clinic, that gets immediate approval. If the patient's new to the system or prescriber clinic, they may get immediate approval. If there's any active ARPA restrictions, that will be fall out of the immediate approval process and will be reviewed one of our officers. Also, if the transfer protocol and the approval is linked to a private clinic, that will obviously have to be reviewed by one of our officers. And then finally, if non-accredited prescribers are applying for patients where the patient limits exceeded for a particular drug, obviously, as you may know, with unaccredited prescribers, they're able to prescribe and hold authority for up to 10 patients for methadone if those patients have been stabilized by an accredited prescriber, or up to 20 patients for the purpose of buprenorphine. Next slide, please. That was pretty much it. Thank you. Over to you, Fraser.
Yeah.
Thanks, Wes. Hi, I'm Fraser. I'll just show you through the new functionality. If you do have any questions, please just pop them in the chat and we'll answer as we go. Okay, I'll just share my screen. Okay. Just checking everyone can see okay? Yep, great. So I'm here on the landing page of the health professional portal. So new aspects of the portal that have arrived in the last few months would be the approvals menu and the correspondence menu right off the bat. I'll show you those in a moment. But first of all, the very first thing that we would want prescribers in particular to do once they start using the application process in the portal is to go to their profile and have a look at the organizations section. So it's important to be linked to all of the clinics that you prescribe at. You can do that quite easily here, add organization, and just search for the clinic by name, suburb or postcode. These other fields are going to be removed. They're not very useful, so they'll be disappearing very soon. I'm just going to search by postcode for now. Okay, and let's see, okay, find my clinic, I'll select it and add it here. And then you'll see that there's a primary checkbox. What that does is when I'm applying for any approval application type, the primary clinic is the one that's going to be selected by default, and then I can change it as I go. So if there's one clinic that I work in the majority of the time, I can set that as my primary. The other thing I can do is remove myself from clinics as well, if I no longer work there. And while I'm here, another section that's relevant to approval applications is the communication preferences. So I've got a contact email address set here, and I'm opted in to the correspondence notification emails. So what will happen is when I put an application in for an approval, if any letters are generated, so an approval letter, a not approved letter, the various other letters that occur along the process, they will show up in my correspondence screen as a PDF document that I can download, and I'll get an email just telling me that I've got something new to read. So I can opt out of those emails if I like. The emails also get sent to my clinic, the clinic on the approval, using the clinic's email address. But yeah, the other thing I can do is I can change my contact email address here if I need to, and then just save my changes here. And that's the setup that's required before you can begin. I'll go quickly over to the approvals screen. So this is a list of all of my approvals and applications in progress. Also, the applications and approvals for prescribers who are linked to the same clinic as me. So as I'm sure you know, prescribers can prescribe under their colleagues' approvals at the same clinic. So it's handy to have access to them here. If I click one of those clinics, sorry, one of those approvals, I'll see a summary. I've got the approval number here, the status, and the relevant dates. This is an exited OTP approval, so I see the exit details and all the information about the prescriber, the patient, and the primary questions on the approval that were answered in the application process. the drug and dose that were last on the approval, and any correspondence associated with it. So for this one is the approval letter, which you can click to open in a new tab and download or print. And just to show you the correspondence in total, so all of my correspondence, my personal approval letters will show up in the correspondence page here. I can access them all and also click through to the patient and the approval. Back on the approval screen. So I can apply for an approval from this screen, but that's not the recommended process. I'm going to show you what we prefer you do instead. Just seeing that there's a couple of questions popping up in the chat. I might answer those before we go further. So question from Daniel, should we expect all clinics to show within the organizations section? No, not necessarily. I expect probably the majority of clinics will be findable, but if your clinic can't be found, probably the rare case, so we should have information about most of them, but if it can't be found, you can enter clinic details during the application process. That would prevent automatic approval because that clinic's then got to be added to the system by PSU. So to apply for an approval, first thing I should do is have a look at the patient. I'm going to go to a patient who I've searched for before. Just to show you that you don't have to enter the full name, you can enter the first few characters or enter more to narrow the results down. Okay, I found my patient here. The other thing to notice is the record type. So there are 3 icons that you'd see here. This patient has the link icon, which means they have both types of record. The 2 types being what we call the transactional profile. That's the SafeScript prescribing and dispensing history, which we've had for some years now. The other type of profile is the regulatory profile, which has like a little business card icon. And that's where all the approval information and other regulatory details maintained by pharmaceutical services lives. So where those 2 can be matched up, they'll appear as a single patient with that link icon. So that's the patient we want to be able to find. Question from Peter, does SafeScript screen for patients who have interstate prescribers? If I understand that correctly, so do we cater for patients with interstate prescribers? We don't record approval information from outside New South Wales. What you can do though is if we have information about the patient, when you are applying for an approval for that patient, you can answer that the patient is on OTP interstate. That doesn't actually affect the application process. It can still be potentially approved. That's pretty much the extent of the recording of interstate OTP currently. Okay, back to the approval process. So when I apply for an approval for a patient, first I need to have a look at the patient's information. Just to note that I'm looking at a test system here, so some of the information might look a bit strange. I've got the patient's monitored medicine history for the last couple of years, all of the monitored medicines that she's been prescribed and dispensed, and any alerts against those as well. And once I've reviewed her medicine history, the next thing I want to do is click through to her profile and see what regulatory information there is. Might save that question from Peter until after I've done the demo, and then perhaps Wes, you might want to answer it in the chat or later. Okay, this is the regulatory record for the patient, so I can toggle between that and the medication history with this button up the top. We've got information about the patient's primary identity. You'll see that we can actually edit some of this. This patient has an IHI, an individual healthcare identifier number that's been validated with the HI service. that Services Australia maintains. So we're pretty confident in the patient's identity. And when we do have an IHI for the patient that's been validated, we can't edit any of these fields that are grayed out. If we didn't have an IHI, then we could enter those and change them. I can, however, edit the patient's address. So any practitioner portal user can make these changes here, enter in newer information if we have it. And I can also record any alternate identities, any aliases that the patient has, which help to be able to find the patient and identify them. So here's the patient's approvals section. These are all the approvals that have been applied for or granted for the patient. I can see that there's a submitted application for OTP that hasn't been approved. That won't affect my application process that I'm going to show you, so I'm just ignoring that for the moment. Let's say it was appropriate to apply for an OTP approval for this patient. So I'm going to go to create approval, choose OTP. And what that's going to do is that will pre-fill the patient's information and answer a few of the questions automatically. So it's always preferable to go from the patient record to apply. Otherwise, two things will happen. One is you won't have that pre-fill happen. You'll have to enter more things manually. The other thing is that you'll have to search for the patient again anyway. Okay, so on the Getting Started screen, we have some information that you need to read beforehand, links to clinical advice and a privacy statement. If I can confirm that I've read and understood all of that, I can click Continue. And the first thing to do is to pick my prescriber clinic. That was chosen by default for me. That was my primary. A patient is pre-filled. I can click here to view them in a new tab if I need to go and correct any of the details, let's say, or review information that that I need to check again. And you also see that your OTP patient limit is shown up here just for your information. So I'm logged in as an accredited prescriber. I've got the limit of 300 total OTP patients. If I was non-accredited, I'd see both of my methadone and buprenorphine limits here. Okay, if I continue on, I've just got the additional patient information to complete. Some of these fields are mandatory, others are not. This question to indicate the patient's current status. If the patient was currently on an OTP approval in New South Wales, that would pre-fill with currently on OTP. And it would also pre-fill with the name of the current prescriber or that it was me, if it was me. And so I wouldn't be able to change those selections. Now, if I choose the patient as being currently on OTP when that hasn't pre-filled, because the patient doesn't have a current New South Wales approval for OTP, the only option I can select then is interstate or overseas prescriber. Now this patient, let's say they are not on OTP, but have been in the recent past. If I know it, I can enter the last dose of OTP medication. I'm going to continue on and select the medicine. So for an accredited prescriber, I can select methadone, buprenorphine, or other opioid dependence treatment medicine. Non-accredited prescribers can select methadone or buprenorphine, but there are limitations, of course, on methadone, which are programmed into the interface here. We'll choose bup for today and then add the medicine details. So that I need to choose the category. Maximum daily dose is pre-filled. I can't change that. So we always approve up to the maximum. Essentially, we don't, for OTP, we don't take applications for a lower than the maximum daily dose, just to simplify the process. I need to enter the proposed starting date here. So the 20th of February. Expected starting dose. And click add. If I need to, I can remove that medicine and add it again. Okay, question from Jenny about correspondence emails. I will touch on that at the end of this process. Okay, next thing is if I'm transferring the patient from methadone to buprenorphine, there's options for the microdose transfer or the bridging transfer, which I'll need to fill out. I won't do those today. I'll continue on. And you'll see a summary of my application. You'll see that the status is draft. And the start date will be the date that the application is approved. OTP, of course, doesn't have a default end date. It's ongoing. So I can review all the information here. Before I submit the application, I'll just show you what happens if you save your changes. So it's saved as a draft. If I go to my approval screen now, I'll see it at the top of the screen as a draft. So if I need to step away, I can save it and come back to it, and I'll jump back into where I left off. And if anything fundamental to the application changes in that time, so any of the patient's details are corrected or changed, or their OTP status changes, it'll take me back to an earlier stage in the application and get me to review that information, and I won't be able to continue through until I've reviewed and updated that and followed through the process based on the new information. Okay, so the final step is to click the declaration to confirm everything is correct and true, and I comply with all the clinical guidelines. I then submit the application, and the application's been approved automatically. So everything I input met the criteria for instant approval. So the approval letter is going to show up on my correspondence screen. I'll show you in a moment. And the next message is just to review the patient's dosing points. And just to be helpful, we're going to take you, when you click OK, directly to the patient's profile, where their dosing points are recorded. So similar to the organization search, if I click dosing point, I get the organization search form again. I can do a search by these search criteria, find the dosing point organization that I organized for the patient to dose at, and save it, and it'll be saved with the start date of today. I can change that start date and end date if I need to. I then just need to save the patient profile, and they're good to go, and I can prescribe immediately. The approval shows up here as approved at the top of my screen. Also, it's on the patient's profile under their approvals. The correspondence shows up here. I can click to view that letter. I clicked the wrong link. I need to click that one. Here we go. And yes, the letter gets sent to my contact email address, or if I don't have a contact email address, it gets sent to the email address that I use as my username. It also gets sent to the contact email address of the clinic organization. So that's the clinic I selected as my prescriber clinic on the approval. If I go to the approval application, sorry, the approval now. So it's this clinic here, user testing clinic 1. If I go through to my profile and find that organization, I can click through to it. And these are the contact details. So if I'm linked to this organization, I can actually update the email address for that organization too, just to ensure that we keep them up to date. So any practitioner portal user linked to a clinic or a pharmacy or any other organization can maintain their email address and their contact information address and so on. And in fact, we can also link other practitioners and remove them as needed. Okay, thank you. That is the kind of the core of the demo. Just wanted to check, where's Karen? Do you think it's worth showing any other aspects?
Nothing from mine, but it will be interesting to see if anybody has any suggestions from the audience. I'm just trying to respond to some questions though. So hopefully some of the questions are a little bit more complicated than others, but please let me know if you need clarification on some of the responses I put in the chat.
Thanks, Wes. Might just open it up for questions of a more technical or user experience nature. Then, if anyone wants to know how something works or how you do something in the portal, I can probably spend a few minutes.
Fraser, I've got a sort of interesting question that follows on from a conversation I had with someone earlier this week. Let's say someone's on sublingual buprenorphine and you wanted to move them over to methadone or even to depot. What's the different functionality within SafeScript to potentially manage that if it's within the system?
Good question. So I just have to refresh my memory on that.
Gave you a tricky one.
I may be wrong, so please correct me if I am wrong, PSU members, but do we require a new application if you are changing buprenorphine category?
Not for buprenorphine category, but if you're going, and just correct me if I'm wrong, Daniel, did you suggest that the prescriber would like to be authorized to move from buprenorphine to methadone and vice versa, or is it just within the buprenorphine?
So the original query I had with someone was within buprenorphine, but I thought, oh, let's discuss, changing over to methadone as well, potentially.
Okay.
Yeah.
So within buprenorphine, the answer is no. So you'll be issued for the generic category of buprenorphine, and that includes injectables where it's selected as part of the application process. If you're changing from one pharmacotherapy drug to another, so from methadone to buprenorphine and vice versa, then yes, you will need to apply because the authority will be issued for the particular drug.
Yeah. Just as a bit of a follow-up, Wes, while I'm here, do you need to inform PSU or anyone that you're changing over from, let's say, sublingual to, Buvidal or Sublocade, or is it not required at all?
That's a good question. So that's another interesting question. Eileen, do you have anything to say before I say anything in terms of the regulatory process from a PSU perspective?
No, I think the system only allows you to change the pharmacotherapy.
Yep.
It really just collects at the instance that you first applied. So say if you applied for buprenorphine, you can select from 3 of the drop down, and that's all you have.
Yep. So yeah, again, just to reiterate what I said, and hopefully it was clear, when we issue an approval for buprenorphine, it really accounts for all types of buprenorphine. It doesn't specify the actual formulation, i.e. it doesn't say sublingual buprenorphine or injectable buprenorphine.
What I can show you though is the process for changing from buprenorphine to methadone or vice versa for an accredited prescriber. So I've got this new application here for the same patient who I was just approved for buprenorphine. When I get to the additional patient information step of the application, you'll see that the patient's status is pre-filled to currently on OTP. I can't change that. And the current OTP prescriber is me. If I continue on, I'm going to select methadone here. I can actually put the application in. Continue through. Put my declaration there, submit. And that can actually be approved straight away. And the really good thing that happens then is the previous approval has been automatically exited with the reason of change of pharmacotherapy drug. So hopefully it's a big time saver. No need to fill out an exit form, set it in, wait for confirmation. You can switch across straight away, and if all the criteria are correct for auto approval, then you can be approved straight away and really quickly start prescribing the new pharmacotherapy.
Only took a couple of seconds too, Fraser.
Good to see. Switching the test environment.
That's it.
Okay, thank you. Not sure how we're going for time, but if there are any further questions about how to do something in the practitioner portal, I'm happy to show.
Okay. Might just continue and then see if there's any more questions.
Thank you.
At the end. Great, so hopefully you can see my screen. So just wanted to talk through a little bit about what support material is available out there for practitioners. So we do have a SafeScript NSW website you may be familiar with already. If not, I'm happy to run through with it at the end if you have some time. We have added a new approval management section to the website, which really details all the information you need to know about what it is, how to apply, how to manage it, and also clinical advice. We have some quick reference guides that you can access on the website. We've updated the frequently asked questions with lots of information on the approval management section. We've uploaded how-to videos. So there is a support resource section specifically housing all of those short videos on how to do various steps in approval management specifically. Also has the quick reference guides and other support material available. And also the health pathways have been updated with this information as well. We also have the online web help, which is really the main and first source of support that users should be using. It's got all the technical instructions on all the various topics. So specifically, we've added approval management in there, and it's also got screenshots. So it's really a sort of first point of call if you're unsure about something or if you want some more information. Web help, you go in there and then you can look at the various topics that there are. You click through, it talks through how to search for a patient, how to apply for approvals, how to get support, basic, troubleshooting support is included in there as well. So that's quite a detailed way to find your information if you have any questions. Okay, so I thought we might do another poll now that we've sort of done the demo and given you some more information on the new functionality. So a couple of questions there. Now that you've seen the demonstration, do you feel more comfortable applying for an OTP approval using the online portal for SafeScript New South Wales? And then the second question is around, now that you've seen the demonstration, you've learned more, how do you prefer to apply? Would you use the online portal? Would you still prefer to apply using the PDF form or both? Just seeing some of those results come through. Great.
And just while that's polls running, I just remind everyone, feel free to put either questions in the chat box, or if you'd like to unmute yourself as well, we'll shortly have some brief time for sort of questions and answers for anything further as well.
Yeah, there's a question about how to do an exit. Yes, I can show you that.
Cool. I think we've had almost everyone voted, so looking good. So I'm glad to see people feeling more comfortable about using the online portal. And then the second question is based on demonstration, would you prefer to apply online? So that's also really good to see as well. Great. I think the next one, was really just about any questions. So happy to open it up and maybe Fraser, jump to you if you want to answer that first question.
Thanks, Karen. Okay, so a couple of questions there. First question from Ayman about prisons and ability of nurses and other staff to manage OTP patients. Yes, there is some ability there for Justice Health employees. We are working on solutions for private corrections staff as well. But I don't know, perhaps Wes or me might want to talk through what's available currently. But what I'd like to show you is the, well, I've got the screen shared, is the exit process. It's very straightforward. If I've got a patient I need to exit, I guess I'd probably look up the patient rather than the general approvals area. let's go back to our same test patient here. So I've got a patient currently on OTP. I can see the status of her OTP approval. All I need to do is open that approval, review the details, make sure it's all correct, and then click Request OTP Exit. I can select the reason for exiting treatment, tick the declaration, and that exit is processed straight away. So there's no review now of exits, generally speaking, by PSU, unless you send them in manually. If you exit a patient online on the portal, it's done straight away. Now you can also exit the approvals of patients, the approvals of prescribers who work at the same clinic as you. So if you're linked to this prescriber clinic here, any prescriber at that clinic can exit a patient. And in fact, those New South Wales Health employee staff, if they're in a public OTP clinic or a Justice Health facility, also have the ability to exit a patient. Might be a good time to show you what I can about those New South Wales Health employees. So I'll go back to my profile and the organisations section. This is my clinic that I'm linked to. See, there's a couple of sections for tables of people here. We've got practitioners and New South Wales Health employees. So what this is for people who are a nurse or an administrator, not a nurse practitioner because they can register for SafeScript as a prescriber, but let's say a registered nurse who manages OTP patients. I can actually invite them into the system. I can't show you the full process here. I don't have the test data to do that, but just to talk you through it. So I'd search for the person first of all, using their name and staff link number. So staff link's the New South Wales Health ID that we use. And if I find them in the system already, I can add them to my organisation and they'll get an invitation sent to them. Otherwise, if I can't find them in the system, I can click Invite Employee, enter their details here. So I need all of this information to do it. And they'll get an email inviting them into to register for SafeScript first of all and to join this organisation. So they just need to click the link in the email, enter a couple of personal details, and click either accept or reject. So if they accept, what will happen is they'll get single sign-on access to SafeScript. So they can log in with their New South Wales Health Staff Link login rather than the regular SafeScript login. And they'll get a limited access to SafeScript. So they won't be able to see everything. They won't see monitored medicine history of patients, just the regulatory information. But they can search for patients. They can see the patient's dosing points and OTP approval history. They can't see other approvals, just OTP. And if they're linked to my organisation, then they can also exit those patients. So they can perform the majority of the roles that they do in the PDF and paper world, just not actually putting in applications. It's only prescribers who can put in applications online.
And just to add to that, Eamon, we are working closely with Justice Health to try to figure out some of the additional needs that might come as a consequence of the unique structure that Justice Health has. So I might suggest that you speak to Katerina to raise any concerns, because we do meet with Justice Health about these issues.
Yeah, because the number of patients we have every day is phenomenal, and the approval is too much. So normally they would send the approval, and then I would have to sign it off myself. So if there's a way on the computer that no one can sign the approval except for me, that would be good.
I think just to, I guess, and correct me if I'm wrong, Fraser, from what I understand, the application process has to be completed by the practitioner, so yourself. But hopefully what we're trying to show you through the demonstration is the process is a lot simpler than going through the paper-based PDF form. But, I appreciate that there is a bit of a change there, but I'm not sure if anybody else in the project team wanted to add to that, what I've just said.
Well, I think if you are part of the public system, so you're a New South Wales health employee, you have nurses working for you in your OTP clinics, we encourage you to invite them because they can fulfill some of the onboarding component, searching the patient, seeing if they're current on program, and doing those checks before, and also updating dosing point and being able to exit, because they will be able to access all the approvals that are associated with their practitioners within the organisation that they're linked to, and be able to manage that component. And that would be seamless and online.
Excellent.
I just had a very quick follow-up question about the exit forms. So for those who are, for instance, in general practice or private practice, if they're wanting to complete it, and if they're wanting to have someone on their behalf within their clinic complete an exit process, should that still be by PDF in this case? So my understanding is that access, that limited access to exit someone, for instance, is only available to New South Wales health employees currently. Is that correct?
And to prescribers.
And to prescribers,
yeah.
yes, yeah.
So yeah, if you're let's say a person with an account to use SafeScript and you're linked to the clinic, then you can exit the patients. So if you don't have SafeScript access, then
no, fair enough.
Not possible.
So someone like a general practice nurse, if they're filling it out on behalf of the prescriber, they should fill out the PDF form in this case.
Yeah, correct. As it stands currently, yeah.
But again, we're hoping, Daniel, that it's a much more streamlined process through the online form. So again, hopefully there will be efficiencies, and it might, in some cases, probably be quicker to exit online versus getting the nurse to fill out the PDF form. But I guess everyone's going to have their own processes in place.
Okay, were there any further questions?
I might point out that we're looking at the approval screen. You can use the filters and you can filter down to patients, because that might make it a bit easier to find current approval that you want to easily exit.
Thanks, Leen. Yeah, so most of the columns can be filtered on or sorted. So yeah, it should be not too difficult to find a given patient or approval, even in a larger organisation like in Justice, let's say.
If that's about it, I can wrap up and show you. I'll share my screen. You see? Yep. So this is the SafeScript New South Wales Program Team contact information if you have any other questions, as well as their website and phone number. They have a nice thank you slide. Thank you everyone for participating and asking questions, and also to the SafeScript New South Wales Program Team. We also wanted to highlight some of the other resources, including SafeScript, as well as contacts for your local AOD service and a contact for DASIS. These slides will be made available on the OTAC website, so if you'd like to just click the link once you get to that slide, that will work. And thank you again to the presenters and audience members for participating in this webinar. Our next webinar will be on the 19th of March on OAT and custodial settings. If you have any feedback that you'd like to give, you can complete a post-webinar survey or email the OTAC inbox. And again, this webinar will be recorded and made available on the website. there's no last questions, I think we'll wrap it up for the day. Thanks again, everyone, and especially the SafeScript New South Wales program team.